the origin of VitalTalk really dates back to the early 1990s. Bob and I were working together, and we were conducting a series of studies on how physicians communicated to patients about difficult decisions toward the end of life. And what we found in a whole series of studies and work that we were doing was that, for the most part, doctors were not doing this in the way that experts might have recommended they do. And in particular, there was a real absence of the recognition of the role of emotion in these conversations, in addition to medical information giving, as well as lots of other things. And we were doing this work, and then I believe it was in 1999, we met Tony Bach, and we found out that the three of us were all thinking about this, and that we also were all trying to teach this as well. And that we also found that we felt that the teaching methods at the time were good, but also were in many ways lacking. And so shortly thereafter, we created a program called OncoTalk. And this was 5 years funded by the National Cancer Institute, in which during that time we trained about, I think, 15% of all oncology fellows across the country, using methods that later became the kind of methods we used in teaching for VitalTalk. And it was really a laboratory for how we could teach this. And we came up with what became the VitalTalk method. After those 5 years of OncoTalk, we got another grant from the National Cancer Institute to do something called OncoTalk Teach, in which we began to train oncology faculty in how to teach their fellows and other learners at the bedside. And at the end of that 10-year experience, we had learned a tremendous amount about communication, about teaching. And we also realized that we wanted to take this beyond oncology, and that we really wanted to figure out a way to scale it to a much larger public, and also to go beyond physicians and to go to other kinds of clinicians as well, all dealing with serious illness. And so we then launched VitalTalk in 2012, and as a nonprofit, to be able to disseminate communication skills teaching nationally, internationally, and continue to develop these methods further. I think there's several things about the VitalTalk method that make it more effective. First of all, we are extremely behavioral. So we really focus on what clinicians are doing, not so much what they're thinking or feeling. Not that those things aren't important, they are. And those kinds of personal qualities can affect how people communicate with patients, but they're much harder to teach. And they require a certain kind of personal transformation. What we knew we could teach was behaviors that would work in the clinical space. So that has been our focus. The other thing is we've really borrowed from the pedagogy literature to understand that people learn communication as a skill. It's very different than learning, for example, medical knowledge. You can read a book and you can learn all about prognosis of a disease or how to treat a particular kind of cancer or whatever. But it's very different to learn how to communicate. It's a skill. It's much more like learning a sport, a musical instrument, a craft. And so to do that, you need several things. First of all, you need to be able to see what good looks like. So we always include some level of demonstration of high quality communication. You then need to practice the skill that you're being taught. And then the last thing is you need feedback on the practicing that you've done. So you need to know whether you're doing something better or worse. And then the last thing I would say we do is we've really worked to break down communication into its component parts. It's very hard to just kind of think about having like a better conversation, but it isn't so hard to remember that every time you find an empathic opportunity in a conversation, to respond with a comment that acknowledges what the patient's going through. Communication skills training brings a lot to the clinicians, their practices, their patients, and the systems that support them in a variety of ways. First, when clinicians have better communication skills, they themselves are more satisfied with their practice and with the work that they're doing. Unfortunately, burnout is very, very high among clinicians today for a variety of reasons. And one of those reasons is that dealing with tough clinical situations can be overwhelming. And sometimes people struggle with that because they don't have the skills to get through some of those tough conversations. When you have the skills, they become markedly easier, and the weight and the burden of those kinds of encounters drops dramatically. I think the other benefit is obviously, and maybe I should have said this first, is to the patients. Having a clinician who is able to meet a patient where they're at, elicit what's most important for them, and create a plan that really matches treatments to what matters most, allows that patient to have a much better healthcare experience, to feel cared for, and to engender trust in their healthcare providers. And so it makes a huge difference in their experience of what they're going through and their ability to manage that. For health systems, we feel that this really can help with obviously patient satisfaction and clinician satisfaction, as I just mentioned, but also probably with other kinds of outcomes. Most likely, this helps reduce the amount of unwanted, unnecessary care that might otherwise be delivered at some of these times, and to really produce the highest quality outcomes for their patients. I wish that clinicians understood better just how important the role of emotion is in their clinical encounters, and that patients will often express a lot of things that they may not even interpret as emotional responses. For example, patients who are overwhelmed will frequently make cognitive sorts of statements, will ask questions about facts. They might say something like, "Isn't there something else you can do?" And when they say that, the natural response of a clinician is to start ticking off, what are the different kinds of treatments I might have available? Are there any clinical trials? All of which is appropriate, and that's the way they've been trained. What they need to recognize, though, is that frequently that "isn't there anything else you can do" is really a statement of distress. It's an expression of angst, of sadness, of fear. And a different response is to look at the patient and to say, "I wish that we had treatments that were more effective. I can't even imagine what you're going through." And that sort of a response will completely change the tenor of the conversation, rather than just ticking off the possible clinical trials that they might be able to investigate. There are lots of challenges of doing this work. Most people come into being trained or come into their communication skills with patterns of behavior that have been grown through years and years of practice. And the more seasoned a clinician, some of them will have some lovely skills, and they may have some behaviors that they've just been using forever, which are not all that effective, but are rooted and are hard to break. And it's the same thing as learning not learning a new sport, but learning to get better at something that you've already done. So if you imagine you're a skier and you've been skiing for years, and you go out to the mountains and you have fun and you go skiing, but you're only like good enough. And if you want to get better, you take a lesson. But what happens in the lesson? You have to undo all those bad habits and learn new skills to be able to get down that hill faster, more accurately, doing all the various things that you want to do, and to go on harder runs. And it's very similar in communication, that you have to sort of break down what you've been doing and relearn those habits. And that can be very, very challenging for people. Along with that, some people are cynical and don't believe that communication is actually teachable. You either kind of have it or you don't. I think that's a very common understanding in healthcare. And while it's true that some people come in at different levels, some people naturally are better, if you will, than others. We know that everyone can learn these skills and that they can be upgraded. So the reward of doing this work is when you see someone make one of those breakthroughs, when you see someone find a new way of doing something that they've been already doing for years. And then they come back to you afterwards and they tell you that it worked. We've gotten notes back from clinicians who have trained with us who say, I went back to clinic and a patient said to me, I've never had a doctor talk to me like this before. That was a positive thing. And we've had many people say that it's really changed the nature of their practice. And almost everybody who takes our courses says that they will take these skills forward and that they will use them in what they're doing. To watch that and to see the satisfaction and see the ease that we can create for clinicians is tremendously rewarding. So the VitalTalk approach depends on teaching faculty around the country, around the world, who are then able to go and teach these skills to others. It's very much of a train the trainer approach. And at this point, we have trained, I believe, a couple thousand faculty who have trained, I'm not sure, 15 to 20,000 other learners. And we could never reach that far if we didn't have all these people out there who are making a difference in their own learning. Yet, what I think is almost more important than the people that they're teaching in all those various institutions around the world is how they change their local cultures. Because when they practice in a different way, when they communicate in a different way, when they teach their colleagues to communicate in a different way, when the kind of care that everybody is receiving in a particular environment feels different, there is culture change. And that culture works to improve this orientation toward patient care for everyone. We've always said since the very beginning of VitalTalk that we are a culture change project. And that's been the most important.